Here at Beth Israel Lahey Health Primary Care, we've done a number of things to keep our patients as safe as possible and keep our team members as safe as possible during the COVID-19 pandemic. We're really continuing to provide primary care to all of our patients. It's just that it looks a lot different than it used to. The majority of our visits now are taking place virtually via telemedicine, and we are seeing patients in some of our practices in person under a number of safety precautions that we've put into place. We do a pretty rigorous assessment or screening process with some questions for the patient to make sure that they don't have any symptoms that might be suggestive of COVID-19 and to make sure that they haven't been exposed in the recent past to anyone with COVID-19. We call a few days ahead of time before the visit, again, to ask those screening questions. The traditional waiting room and the traditional check-in process, by and large, doesn't exist anymore. And so what we do is call the patient while they're still in their car or while they're out in the building lobby if they arrive, say, by public transportation, and do the check-in process that way over the phone, and then make sure to escort the patient directly into the exam room. We've put in a couple of really important protocols for cleaning and disinfection of the practice. One is disinfecting the exam room after every patient visit. And there's a multi-step process to doing so. And we're using products for disinfection that have been approved to be effective against coronavirus. After each patient visit, we also make sure to disinfect or clean every high-touch surface that the patient may have encountered, such as doorknobs, such as countertops, such as the restroom. At all times, our team members are wearing masks and also face shields to provide some eye protection. Patients are also being asked to wear a mask at all times while they're at the practice. Patients can wear face coverings that aren't the traditional surgical masks, so it could be a homemade one or one that they've purchased or obtained elsewhere. As long as they have something that's covering both their nose and their mouth, then that's acceptable. The goal of wearing all of these pieces of personal protective equipment really is to keep both the team members safe and the patients as safe as possible. When patients call us, we're going to make sure that we decide together with the patient what the safest and most effective type of care is for that patient.